Good morning, good
Vamos a empezar.
afternoon,
Un
greetings,
momentito,
everyone. We're going to
vamos a
start a
continuar.
little bit late, but it's okay. We'll be fine.
Vamos a esperarnos un minuto para dejar la gente que entre.
Let's wait just a quick minute to let people come in.
Ahora sí, vamos a empezar. ¿Sí me escuchan?
Let's start. Can you all hear
Bueno,
me?
Sí.
Te escuchamos, Marta.
Yes, we
gracias,
can
Alma.
hear you, Marta.
Y
Thank
quiero
you,
empezar en
Alma.
confianza
Thank
con
you for
todos
being here with
ustedes
us
para nuestra
today
presentación
for our
hoy,
presentation,
aumentando la confianza, preparando a
building
los
trust,
gestores de salud
equipping community health
y a los
workers,
equipos
and
altamente
outreach
voluntarios para
team
las vacunas
for
de
fall
otoño. Muchos de
vaccine.
ustedes ya me
Many of
conocen a
you
mí y se
already
están preparados
know
en
me.
su
I'm
perfil
Marta
de educación
Alvarado.
en línea para
I'm the
MCNs.
online community
Tengo
education online education
unos
manager
comentarios, unas
for
cosas
MCN. I have some
para decirles a ustedes,
comments
pero denme
to
un minuto,
share,
por
but
favor.
just please give me a quick minute.
Ok, vamos a continuar.
So let's go
Nomás
on.
para decirles que
Just to tell
en
you
vivo en sí se está
that
grabando
this
en
presentation is
inglés y en
being
español.
recorded in
Todos
English
los que
and
se
in
registraron para
Spanish.
asistir
Everybody that
van a recibir
registered to participate will
los
receive
enlaces a las grabaciones
the
en su correo
links
electrónico de
to the
seguimiento
recordings
que
in a
se enviará
follow-up
más tarde
email
hoy
that
día.
we will send later today.
Y bueno, en
And
algún momento, si ustedes
at some
tienen
moment, if you
una
have
pregunta durante la
a
presentación, por favor,
question
las
during the
ponen en el
presentation,
chat
please
y los
drop it
podemos
in the chat and
responder
we
más tarde
can
durante la presentación.
respond later to during the
Y
presentation.
déjenme ver la próxima diapositiva,
And the
por
next
favor.
slide, please.
Gracias. Como les dije, este
Like I
webinar se
said,
está
this webinar
interpretando
is being
simultáneamente al inglés.
simultaneously
Para eso
interpreted
vayan a la
into
interpretación
English.
en
If you
inglés
want
en la
to
parte
listen
inferior de
in
la
to the English
pantalla.
interpretation, go to the
Zoom,
bottom of
hay
your
un
Zoom
icono como
screen. You'll
forma de
see
globo terráqueo.
a globe
Hagan
icon. You
clic en
click
él y aparece
on it and
un
you'll
menú
see
donde
a
podrán
menu where you
seleccionar
will
su
be able
idioma
to
de
select
escucha preferido.
your preferred language.
Para seleccionar el idioma de
To
representación de las diapositivas que
select
prefieran
the
ver en la
language of
parte
the
superior de
slide
la
deck
pantalla,
that you want to see, please
verán
go
dos
to the
pestañas con
top of
las
the screen. You're
etiquetas,
going to
unas
see
que dice
two
English,
tabs
otra que
with
dice español.
two,
Simplemente
the one
pulsen
says
su
English
idioma
and
preferido.
another one that says Spanish. Just choose the one that
La próxima,
is
por
your
favor.
preferred language. Next slide, please.
Y bueno, tenemos muchísimo material que
And we
queremos
have
así que
so much
debido a su
material to
tiempo voy
cover
a
today.
ser así
So,
muy
given time
rápida en
constraints, I'm
resumirlo.
going to
Muchos de ustedes
quickly
conocen a
introduce
Alma Galván.
our speaker. Many of
Alma
you
es la
already know
directora
Alma
de
Galman. Alma is the
capacitación
Director of
y
Training
participación
and
comunitaria de
Community
trabajadores
Participation
de MCN.
for
Tiene
Community
ella
Participation for
una
Workers at
experiencia
MCN. She
en
has extensive
explicación de
experience
asistencia
in
técnica
providing
y en el
technical
desarrollo de
assisting
currículos y
and
materiales
developing
educativos
curricula and
para
educational
adultos.
materials for
Alma ha
adults.
trabajado
Alma has worked
extensamente con aliados
extensively
de MCN,
with MCN
organizaciones
partners,
comunitarias,
community
agencias de salud
organizations, health
y
agencies,
departamentos de
and
salud
local
locales y
and
estatales.
state health departments.
Estamos muy felices de
We're
tener
happy
conocerle
to also have
nuevamente al
with
doctor
us
José Rodríguez,
Dr.
que
Jose
estará
Rodriguez with us
ofreciendo
again today, who will
cualquier
be
apoyo necesario.
offering any
Doctor Rodríguez
necessary support.
trabaja en
Dr.
el Hospital General
Rodriguez
Castañer,
work at the
un
Castañer
centro de
General
salud
Hospital, a
federalmente
federally
calificado
qualified health
desde que
center,
terminó su
since
residencia
he
en medicina
completed
familiar
his
en
residency
1990 y
in
desde el
family
2009
medicine in
trabaja como su director
1990, and
médico.
since
Y con eso le
2003, he
doy
has
la
served
palabra a
as its
ustedes, Alma. Muchas
medical
gracias por estar con
director.
nosotros.
And with this, I pass it on to
Muchísimas
you,
gracias,
Alma. Thank you so much for
Marta.
being with us. Thank you so
Buenas
much,
tardes a
Marta.
todas y
Good
todos.
morning, good
Gracias por estar
afternoon
con
to
nosotros.
everyone.
Y
Thank you
pues
for being
bueno,
here with
vamos
us.
a empezar el día de
And let's
hoy.
start today.
Esperamos el doctor y
We
yo tratar
hope
de
the
resumir las
doctor and I that we
recomendaciones
can
clave para las
summarize the
vacunas de
key
otoño, en
recommendations for
donde él
fall
ayer
vaccines,
hizo
where
una
he
presentación muy
yesterday
extensa.
he did a
Vamos
long
a ver
presentation.
básicamente tres
And
cosas:
we're
la
going to look at
influenza, el virus
three
respiratorio
things
sincicial,
mainly: the influenza,
Vamos a
RSV,
identificar
virus
recursos
respiratory,
confiables y formas de navegar
and
por
the
este sistema de
COVID-19. So
salud
we're
para
going to
ayudar a los
identify
residentes de
reliable
su
sources
comunidad.
and referral
Vamos a
pathways to all community
identificar
members
también
across
algunas de las
vaccines and
barreras que
over
impiden que
um,
ellos tengan acceso a
barriers.
estos servicios. Explicaremos,
We're going
trataremos de
to
explicar
try
cómo
to
se propaga
explain
la
how
información
misleading
de una manera
information
adecuada
and rumors
y cómo
spread
nosotros podemos
and
utilizar
how
eso
we can
para
use
nuestro
that
beneficio
to our
y para las
benefit
comunidades de cada
and
quien.
for
Y por
underserved
último,
population.
demostrar
And
estrategias de
lastly, we're going
comunicación
to
basadas
demonstrate
en la
communication
confianza
strategies
y
that
la
emphasize
aceptación. Vamos a compartir con
confidence and
ustedes algunas de las
uptake.
lecciones
We're going to
aprendidas en nuestro
learn with
trabajo.
you
¿Ok?
some of our
Y con
lessons
esto,
learned in
pues
our
le voy a
work.
dar la
And
palabra
with
al
this, I will
doctor para
pass it
cubrir
on
el
to
primer punto, que es
Dr.
hacer
Rodriguez
un
to go
resumen
over the
de las
first
actualizaciones
point, which
claves de
is
vacunas que tenemos para este
summarize
otoño
the key vaccine
2025.
updates that we have
Doctor.
for the fall of
Saludos y buenas
2025.
tardes a todos.
Doctor, greetings, good
Acá en
afternoon,
algunos sitios
everyone.
será buenos
Even
días, ¿verdad?
it might
Pero
be
en
good
Puerto
morning for
Rico
some
estamos
of
de
you,
tarde.
but
Sí,
here in
antes de
Puerto Rico,
comenzar
it's
quería
the
mencionar
afternoon.
por qué
Before we
estamos
start,
haciendo
I
esto, ¿verdad?
wanted to
Estamos hablando de las
talk
vacunas
about
de
why we're
otoño
doing this. We're
porque
talking
son las
about the
vacunas que van a
fall
protegernos
vaccines
principalmente
because
contra la
they
temporada de
protect
enfermedades infecciosas
mainly
respiratorias
against the
que usualmente
respiratory
empiezan
infectious
en
disease
otoño, aunque
season that
hay
starts in
sitios
this
que es
in the
durante todo el
fall.
año,
Some
pero
places have
en el
it
área
year
de Estados
round,
Unidos y
but
Puerto
in the
Rico
US and
usualmente
Puerto
comienza en
Rico, it
otoño.
usually
¿Por qué
start
esto es
in the
importante?
fall.
Porque estas
Why is this
enfermedades
important? Because
respiratorias
these respiratory
superiores
diseases,
e
upper
inferiores que
respiratory
empiezan en la
diseases, lower
nariz hasta llegar a los
respiratory
pulmones y
diseases that
pueden causar
start in the
sinusitis,
nose and can go
pulmonía, que
all the
causa
way to the
muerte, ¿verdad?
lungs. They can
Y estas se
cause
transmiten de persona a
sinus
persona.
infections,
Y por eso es que es bien importante
bronchitis, and
que
or
todos
even
estemos
death, and they are
vacunados para
transmitted from
evitar
person to person, and that's
que nos dé la
why it
enfermedad
is
y si nos da,
important for
como
everybody
quiera
to
nos
be
puede dar, que
vaccinated.
nos dé más
And if
suave,
we
disminuir la
get it,
gravedad,
because we could still
disminuir las
get it,
hospitalizaciones y
we
las
need to
muertes,
make it
que eso es
milder,
lo
reduce
principal, que
hospitalizations and
nosotros
death.
que al ponernos las
That's the main
vacunas
thing, that
no
when we
tengamos
get
que ir al
the
hospital, no
vaccines, we
tengamos
don't
alto
have to
riesgo de
go to
estar
the
hospitalizados por
hospital
una
or have
pulmonía
a
o
high
alguna
risk
otra
of
complicación que
hospitalization for any
podíamos
kind of
haberlo
complication,
evitado por la vacuna,
lung
que la
infection,
vacuna es el
whatever,
mejor método que hay de
and we can
prevención
avoid it
actualmente.
with the
Vamos a hablar de
vaccines,
las
which is the
vacunas. La
best
influenza es una
prevention
vacuna que
method that we currently
usualmente se
have.
usa de
So we're
septiembre a
going to talk
octubre,
about the flu
principalmente que se
vaccine. We
debe
use
comenzar
it
en Puerto Rico
usually from
prácticamente
September and
todo el año,
October. In
es
Puerto
hasta
Rico, we need
junio.
to do it
Hay otros
all
lugares
year
que son
round up
hasta
until
6 meses
June.
nada
Some
más,
people
pero en
are,
Puerto
in
Rico
some
es todo el
places,
año. La
they
influenza
use
es
it
una
year
incidencia
round. Some
alta,
places
es
do it
una
6 months. In
gripe, es
Puerto
un
Rico, do
catarro
it
fuerte,
year round.
pero que
So
puede tener muchas
the
complicaciones
flu
y
is
puede
like a
hasta
really
causar la
strong
muerte
cold,
y
but
causa muchas
can have a lot of
hospitalizaciones a
complications, can
nivel
even
de
cause
todo
death,
Puerto
and
Rico y
causes a
Estados
lot of
Unidos. Se
hospitalizations in
recomienda
Puerto
luego de
Rico
los
and the
6 meses
US.
de edad,
It's
si
recommended after
aquellos
6 months of
niños
age,
que antes de
and
9 años
kids
que se les
that
administra por
before
primera vez la vacuna, hay que
being 9 years
administrarles dos
old that
vacunas.
get
Se
the
administra
vaccine for the
una
first time, they need
hoy
to
y hay
get
que
two.
esperar un mes para
They
administrarle
get
la
one,
segunda
and
dosis
then a
para
month
que esté fuertemente
out, we
protegido.
need
Y las personas
the second dose so
con
he can be
complicaciones
really
como
protected.
diabetes,
And people that have
hipertensión,
complications like
problemas
diabetes,
de asma,
hypertension,
COPD,
asthma,
problemas otros
CO,
respiratorios, pues
uh,
están a más riesgo de tener
POs,
complicaciones
COPD,
y esos son los que tenemos que proteger.
they
Además,
have a
las
higher
personas
risk of
mayores, ¿verdad? Que ya su
complications, so
sistema
we need to protect
inmunológico
those.
empieza a
And also
disminuir,
older
tenemos que protegerlos
patients,
con
because
vacunas. Las
their
vacunas
immune
son
systems
soldaditos que nos
starts
preparan a
to be
nosotros
weaker, so we
para
need to
cuando
protect them with
estemos
vaccine. The
expuestos
Disculpa,
vaccines
doctor.
are
Disculpa,
Ajá.
doctor. Bueno, los intérpretes, por favor, si puede, más
Ir más
despacio, por
despacio.
favor.
Está
Más
bien, sí.
despacio, por favor.
Sí, está
Muchas
bien.
gracias.
please,
Sí.
please go.
Lo otro, las personas mayores, ¿verdad?
Please go slower. So older
Es bien
people,
importante que la tengan porque su
it's very
sistema
important for them to have,
inmunológico
because their
va
immune system,
disminuyendo
it
con
gets
el tiempo.
weaker
Lo otro,
over
aquellas personas
time. And
que
then there's
padecen de
other
diabetes,
people
que tienen
that
algunas
have
complicaciones,
diabetes or
que
any
pueden tener
complications
riesgo alto
that can
de
have
morir.
be at high risk
Influenza,
of this. So
mayor de
the
6 meses,
flu
a todo el mundo.
shot is
El
anybody
otro
over six
es el
months of
virus
age. The next one
respiratorio
is the respiratory
sincicial, que
syncytial
causa
virus,
alrededor
RSV, that
de 58.000
causes
hospitalizaciones al año en
is
Estados
responsible for
Unidos
about
y casi 500
58,000
personas que
hospitalizations
mueren,
every year
especialmente
in the
niños
US, and about
menores de 5
500
años.
people die, especially
Esta es
kids under 5 years of
segunda
age.
causa de
This is the
muerte a nivel
second cause
mundial,
of death
¿verdad? Seguido
worldwide,
después de la malaria,
followed by
es la
malaria.
segunda causa de muerte porque es un
Or
virus
no,
que
sorry,
ataca
after malaria is the
principalmente
second
a los
cause of
niños,
death, because it
a los
attacks
bebés
mainly
y
children,
a las
babies,
personas de mayor edad.
and older
Este es
patients. us This vaccine is recommended mainly for adults over 75 years or those between 50 and 74 years of age will have an increased risk that could be cause complications like I mentioned, diabetes, hypertension, heart disease. It's also recommended to protect infants before 2 years of age. The mom gets vaccinated between 32 and 36 weeks of pregnancy gestation. Why? Because why during this period? Because the vaccine takes some time for the mom to create the antibodies or little soldiers that will be transmitted through the placenta to the baby. So when the baby is born, then the baby will have protection through the vaccine, especially if the birth of the baby is between July and March. It's more important to give this shot because during that period of time, if the mom is going to give birth during that period of time, and it's recommended that between 32 and 36 weeks gestation, they can get protection. For kids, there are no vaccines for kids, but we have some monoclonal antibody prophylaxis that are available for when the baby is born, and we can administer that under before they're 8 months old. It's not a vaccine; it's an antibody that is going to protect them so they don't get the virus. Then that causes problem. This virus causes a lot of respiratory problems. So we protect them by administering the shot to the mom that will transmit the antibodies to the baby or giving monoclonal antibodies to the infant. Those kids that are 8 to 18 months of age and that have conditions that might be a risk, asthma, pulmonary fibrosis that incapacitates them. It's also recommended for them to get the monoclonal antibodies. This is really important because this will protect them. If the mom took the shot, it is not necessary to give the monoclonal antibodies to the children. The mom can only take the shot one time. So in the following year, she is pregnant again and she's going to give birth between July and March, that child will need to get the monoclonal antibodies. That it's important to protect them. And if there's any complication before 18 months of age, remember it's not a vaccine, it's a prophylactic method to avoid the transmission of this disease and reduce the risk for kids. And the other vaccine we have for the fall is COVID against COVID-19. There's many changes over the last few months in this vaccine because the idea is that there are going to be some conversations between the physician or the provider, the pharmacist, the health educator, the outreach educator, so the patient could get educated on the advantages of getting the vaccine and the potential risk. And this it helps the patient could get this idea that the vaccine could be good for them and that they're not afraid of it. So for people from 6 months of age to 64 years of age, you need to evaluate, you need to discuss risks and benefits. What we want is that everybody is educated and really understands the benefits of vaccine, that we agree that it is the only way we can prevent it. We can use universal measures which will help us, but vaccination plus universal measures will really help us and create less problems. Next, we are in a in a season of confusion because the FDA and the medical society's recommendations go against. The FDA evaluates the vaccine and and has some and recommends the use of the vaccine and has some recommendations in the package. So we see the American Pediatric Association says that every children under 2 years old need to be vaccinated. The American College of Gynecologists recommends the shot for every pregnant woman. the American College of Physicians and the American Society of Infectious Diseases recommends this for everyone. So there's some associations that have their own recommendations, and states also issue recommendations, the pharmaceutical associations. So there's many recommendations. There's a lot of misinformation uh, that you see on Facebook, in digital media, because the neighbor had a bad experience, etc. So this creates a confusion, and the new strategy is that this is a shared decision. It's not a barrier. It's a conversation between providers and the patients to avoid this confusion. And then you can have a conversation with your trusted provider that has trusted information, and you can talk to them, have a conversation, and decide what you're going to do, because the messages are contradictory between providers and the labels by FDA, and this doesn't cause confusion. This causes confusion, and then as a result, the families and marginalized communities, health care providers, pharmacists are confused, and they don't know what they're going to say. So
Therefore, we recommend that you get together with your trusted provider and discuss on the benefits, pros and cons. Next. There are variations per state. We have 26 states that have announced broader access policies for people to get vaccinated. We have 13 states who now require state-regulated health insurers to cover it. The pharmaceutical authorities say you can even vaccinate children as young as 3 years old. And in Puerto Rico, you cannot actually vaccinate minors. Now it is provided by the Department of Health, but not the vaccination center. There are some special centers of the health department that you discuss with the patient and then accept to administer the vaccine, and they need to be referred to an area where the health department evaluates it, and then the vaccine can be administered. So we have some medical plans who actually provide the vaccine, others don't, and also the co-pays are very high. So if you're working in agriculture and you have low income and you're going to pay $250, $300 as co-pay, you need to work 2 or 3 days to decide if you buy food or vaccinate. So this generates a confusion, and it will turn more difficult to make the decision. Other states have not yet clarified coverage or access, creating uncertainty for uninsured or underinsured populations. You have heard the president and Mr. Kennedy having their ideas, but we are scientists, so we just speak from the scientific point of view. And the scientific base says that the most important prevention is vaccine. Universal measurements help us for vaccination, and it is prevention, the one protecting us and our families. Next. Alma, let me give you the floor. Thank you very much, doctor. And well, now, after everything the doctor told us, our job as health promoters or CHWs is to provide this information to the community. And one of the things we need to do is clarify who makes the recommendations, why do they change after certain season, why they review all this, why they change all this. Well, it is important for us to learn to be able to spread it out to others. How is it that the FDA, which is the Food and Drug Administration, which is the organization or the agency that researches how the vaccines work, if they are efficient or effective, they do all the job of finding out how to prescribe them. And they are the ones testing the vaccine to be used in humans. And then after this, once they do this, they send it to an advisory committee on immunization practices, which is ACIP, the acronym in English. We love acronyms, but it's very important for us to know what they mean. So this is an advisory committee, and it's an expert group who knows about health and review all the investigation and research made by the FDA. And then they recommend how this vaccine should be used. This committee belongs or is part of the Centers for Disease Control and Prevention, famous CDC, right? They, once they receive the recommendation of this advisory committee, they review this recommendation and then they set a scheme. When are the peaks of these diseases? When is it better to use the vaccines? And depending on age, season, and health conditions. Therefore, we're able to see these recommendations that some are for children, some are for high-risk people, some are for adults. They are the ones who indicate this. Once this happens, this mandate is then sent to the states. Each of the states has a different policy and a specific health department who receive these mandates, and then they decide where you can find this vaccine and when, depending on the insurance coverage. And then you get to see that some states require some things, others don't. After this, the states, as they are independent, they send to their different health departments and centers at the state and local level and the pharmacies for them to actually apply the vaccine. They will be the ones providing the vaccine, depending when, where, they will tell us. In this case, beside the health centers that are local, we also have the pharmacies, which are health businesses who provide the vaccines. Besides this, there are other things. We have certain organizations which are independent, such as the American Infectious Disease Society of America, the American Academy of Pediatrics, the American College of Physicians, and the American College of Obstetricians and Gynecologists. They are independent of everything else at a state level, and they also issue recommendations. Therefore, at this point, we will be able to see the recommendations coming from the state, but as well the recommendations coming from these societies, which are independent, but who are experts in this topic and who we should also trust in. So, well, this is extremely important for us to understand it and then be able to spread it out to the right people that we work with. And well, we need to understand and identify which are the barriers and structures that we need to consider in order for us to provide all this information provided by the doctor or recommended by all these agencies to the community. So if you can write on the chat some of these barriers and structures, please, that you believe we find around there and that we need to work with, I would like to hear or read what you write. Okay, I see myth and reality. Monica says, Rene says HHS fired the experts, the true expert of that committee, and then they placed, and I'm going to go back to this comment, that they fired a lot of the people of this advisory committee, and that now the recommendations are in the hands of people who do not have this expertise, are not qualified. That's why now we are leaning on these other organizations who are very trustable and can also shed some light. So that's why we get confused. Thank you, Rene, for letting us know this. Yes, people who do not have insurance or people who do not trust doctors. Yes, we're going to be reading about it right now. And so, well, we're going to try to go step by step. Well, maybe you know this very well, but it's insurance covering. Who has insurance, who doesn't? This is an important piece because if vaccines will now require you to have a prescription to be able to get it, if you do not have an insurance, who will give you this prescription? Another thing is that 90% of COVID vaccines were administered in pharmacies. But right now, there is a major disruption. Why? Because the mandate goes to the state, and then the state lets the pharmacists know. So as long as we don't have a prescription, if we don't have a mandate that is obvious for this material to get to the pharmacies, we will have an interruption. Then it's not as easy for people to obtain the vaccine. Without insurance, people will have to pay for the vaccine. And the COVID one is around $225 and $250. Who has this money? And this cost usually used to be free. Now is out of pocket for uninsured patients. So that is economic barrier that is so important. Another thing has to do with logistics. You know, the clinic hours, the general availability of doses. In some states, it is not available in the pharmacies or the centers. And even if the person wants to get vaccinated, talk to the doctor and decided to get vaccinated, it's not available yet. So that's another issue. Transportation is another barrier that for us is complicated because you don't find it everywhere. Now you have to go wherever the state tells you to find it. This could be the local health center, and it depends. Another important piece has to do with the politicization of the vaccine, and not only the vaccine, but public health in general. What do I mean by this of politicization? Well, they are taking public health vaccines as an instrument to manipulate the decisions, the political decisions. Now it does not depend on the expertise or research, but it also depends of the political party, and unfortunately, it shouldn't be that way. Health should be totally independent of politics. Nevertheless, we are seeing that they are mixing it, and this contributes in a high degree as a barrier to have access. Another element, and I want to be very clear about this, and I want to say I'm not speaking in terms of the current administration. I'm just speaking about the barriers of using public health as a political tool. Another one is the government shutdown. Right now, the government is in a shutdown, and there's limited support from government agencies during this time. This also means lack of access to vaccines in many areas. And all this we are seeing includes a lack of updated and accurate communication if the experts have been fired. And we are getting recommendations from people who do not have the expertise, then this is not helpful to trust. And it increases confusion and health inequality, unfortunately. Another important thing we need to consider is health literacy. Before, vaccines were there available and you had to put them on. And now the person has to talk to the physician. First, they have to have a physician to begin with if they have any health services. And they also need to learn how to navigate the system. And unfortunately, we do not have a lot of this knowledge. That is part of our job as CHWs, to help people on how to navigate the system. And also the institution has this responsibility of knowing what their patients require. Unfortunately, we are lacking the work on one side and the other. This is the institution as well as people to learn about the system.
Una cosa es conocer el sistema y otra cosa es navegar el sistema. Por
One
eso,
thing is to know the system, and another one is to navigate the system. What are all these names in the graph? CDC, FDA, APA. We need to know what it's all that.
y bueno, todo esto,
All of
toda esta
this,
revoltura que
all
estamos
this
viviendo, toda esta confusión, todo este
confusion,
de información,
mixture of
da
information
más miedo a la comunidad.
creates more
Comunidad
fear in
más
the
vulnerable
community, in the
es
most vulnerable
precisamente
community.
la comunidad que es más afectada
Is the most
para
vulnerable
poder
community
acceder
is the
y
most
poder
affected
tener
one to have
servicios de salud, en
access
este caso,
to
vacunas.
health services, in this
Entonces,
case,
no me voy a meter mucho en esto,
vaccination,
yo creo que
vaccines. I'm
todos
not going to go
ustedes
too deep into
saben
this. I
mucho de lo
think
que estoy
you
yo
know what I'm
hablando,
talking
lo
about.
podemos poner a su
We can
disposición este artículo,
provide
esta
send
investigación sobre la política
this
migratoria, trabajo y salud, el impacto que
article
tiene
about
las
migration policy,
políticas
labor and health,
migratorias en
and
el
the
trabajo y
impact
en la
of
salud.
immigration
Y esto fue del
policies and
2021.
on labor and health. This was for 2021. Imagine if this if this gets magnified. Imagine how this hostile conduct, behaviors, and stigmatization makes people fearful, stressed out, isolated, not accessing health services, and of course that they avoid participating in the community. So yeah, we'll leave it there for you. So generally speaking, we can summarize that our current reality is like the messages are confusing, they're inconsistent, they're not clear. So there's very little motivation to vaccinate for economic and immigration issues or confusion. People are getting vaccinated less. But something that is very, the doctor said that is very important is that the vaccine, not just COVID, but all vaccine is the most effective way to prevent disease and death, many diseases. So we need to send this information to the community. I don't know if you have any comment, any question, anything, you please drop it in the chat. We'll have a few minutes at the end. So we want to share some promising practices that we have collected through the experience we have through the community health workers, through everything that we went through during COVID. We built a lot of community trust. That's something that we have left over from COVID, but we also learned that it was so important to listen to what people think, to what is the confusion for people before we speak. We have that tendency to speak before we listen. So let's listen to what people want. We need to recognize what concerns people before we, start speaking. We need to listen. What interests them? What is their concern? Maybe their main concern right now is immigration. Maybe they're concerned about deportation mainly. But after that, are they concerned by family, the community? So we need to. And before we speak, we need to ask if they wanna ask, hear or listen to what we have to share. But if you listen first, there's greater possibility that this person will listen to you and want to listen to you, because if people don't want to listen to you. Why spend the time and effort if the other person is not going to listen to you and not going to try to understand? So we need to realize when people want to receive our information and when they don't. And I know that is complicated. So there is very little credibility in people about the COVID vaccine, and there's a rejection against the vaccine, and they're completely, all right. You're completely right. And once that we ask permission to share, we need to use example. We need to make what we have to say be meaningful, have a meaning for them in their words that makes sense for them, that is appropriate. If you're talking to a farm worker, you're gonna give him an example of uh, a person that is very affluent. You're not going to tell them to go to a Zumba class in the morning when this person needs to go work in the morning. You need to use certain things that are culturally appropriate, and that depends on, or that it means that you need to know this person. You need to emphasize anything that has to do with protection, the family, the peace of mind that we have, that we're not going to get sick, we're not going to die, especially if we're the breadwinners at home. We bring home the paycheck so everybody can eat, or we send money back home to our countries of origin, and we need to recognize that what might be important for you might not be important for the person you're speaking with. So we need to approach them from their areas of interest, from things that are interest them. Something that is also really important is we need to be transparent. When we have questions and we don't have answers, we can say, hey, I don't know, I'm going to look into it, or say things are changing. That's why it's so important for us uh, to have this conversation. Why? Because we need to talk about the fact that there's confusion, the experts were fired, there's different messages. Who do we listen to? And we are there facing them. We need to respond to what people ask. So we need to be very attentive to what is happening. I know we're tired, but like I said, the main thing is that health is becoming political. Vaccines are becoming political, and we need to be very attentive to that. And I think if we at the scene, we are constantly reading at MCA, and we're constantly reading and passing on to you this information. And like Dr. Rodriguez said, thing is that the person needs to make a decision with their health provider, and they need a prescription and decide that they will get the vaccine, and then they go and get the vaccine. So we need to promote decision making. We need to foster decision making among people. We can't pressure. We shouldn't pressure people. We have free will. Nobody likes to be pressured into doing something. We need to provide information and let people make the right decision for them. If you can see, there's this word which is reconstructing, like the our friend in the chat said, community trust vanished. People do not have trust right now. They don't know who to believe. So we need to reconstruct this. And it's like when a vase breaks, it can be put back together, glued back together, but it takes more time. So we need to recognize what we lost. It's not our fault, but we are the ones who are going to suffer the consequences, and we are the ones who are going to glue the vase back together. So we need to prepare. We need to continue reaffirming that vaccines are very important. The most important thing to protect ourselves, protect us from diseases, especially with COVID. We need to clarify, like the Dr. Rodriguez said, that the vaccine will not necessarily avoid or prevent you from getting COVID, but it will, if you do get COVID, it will be lesser. You won't end up in the hospital. You won't die. And remember, it's very important to take time, have patience. This doesn't happen overnight. We need to start all over. And the good thing is that we have the experience. We know what we need to do. And now we just need to do it with a little more time, with a little more space. And one of the ways to do this is taking the time to learn. We need to learn even more about popular education and health communications. You always learn. There's nobody that knows it all. We all need to grow ourselves, especially when we have that responsibility to go to the people. So remembering that trust grows once one understands the other one, because the other understands why the other person is hesitant, why they don't want to get a vaccine before we start fighting with them. You need to get a vaccine. Like, why do you think that? What are your facts? Can I share something with you? Would you like to hear a different perspective? If they say yes, oh, go for it. If they say no, you're like, okay, it's okay. Maybe at another moment. So that's part of what we think and how we can go little by little reconstructing this trust. And then for this, we said in our objectives that we were going to share some of our strategies, and one of our strategies is that we can visually understand the misinformation. Some of you have already seen this because in 2021 we worked really hard on this. We worked a lot on this. What is this? It's fake information that is not updated, it's incorrect, that is shared with the intention to confuse or trick people. How is it spread? Like Dr. Rodriguez said, through social media a lot. And social medias are really good because in a moment they can sow information in us, and we're not good at that. We we talk a bunch instead of saying things to the point. So we need to learn how things spread so we can use alternate methods. And now we have something else, which is AI, where you can make videos, images that sometimes are not true, but that look real. And so on top of it, we have that other thing. And all the slides are going to be available for you. So the thing, word of so word of mouth is one on one, mouth to mouth, ear to ear, eye to eye, through schools, community health centers, the neighborhoods, all those community spaces, or maybe when you're by yourself, an Instagram, WhatsApp, etc. You learn what's happening, true or not. You get all that information. So what we need is to realize why all this information spreads so quickly. Why? Because there's fear, and people we look for information with Dr. Google instead of calling Dr. Rodriguez. It's really hard. Sometimes we don't have the language to go and talk to somebody that can explain things to us. It's easier to go to TikTok or go to Google. So we trust people that send TikToks a lot. I have a brother who sends me TikToks all the time about any kind of topic, truth or not. And sometimes I'm like, hey, careful, this might not be true. Let's look at the source. So we need to develop ways for us to respond to this. So sometimes you learn more through your heart than through your head, and that's really important. That's something really important that all the influencers use. So just keep an eye on that. We need to learn to become influencers, people that influence people. We need to have
Bueno,
that.
esta es la información
And well,
falsa,
this is
¿no?
the
Ahora,
misinformation.
¿cómo es la desinformación? Es muy
What
similar.
is
Es
disinformation?
muy
It's
similar
very
porque es
similar
información falsa
because
que se
it's
crea y se
fake
comparte,
information that is created and
se
shared,
esta se hace un
and
poquito más, de manera más deliberada,
this
¿no?
is more
La otra a lo
deliberate.
mejor no
The
tiene
other
ninguna intención.
one
Pero
maybe
esta
is
sí
not
puede tener una intención
ill-intentioned, but
para
this could have an
engañar.
intention to
Entonces,
trick people.
pues bueno, igual con
So
estos algoritmos
with all these
de medios
algorithms
sociales es
in
como
the
se,
social media, that's
se
when
propagan, ¿no?
you can spread
Igual
this, and
es a través de la
it's
confianza,
through
para hacer
trust
dinero,
to make money
para que compren productos
so
y
that people
también
can
se
buy
usa en
products.
política, porque es
It's
ahí
also
donde
used in
entra
politics.
para dividir a las
And that's
comunidades,
when
para
we go into
debilitar las
divide
conexiones sociales.
communities to
Entonces,
weaken social connections.
desafortunadamente, tendemos
So
todos nosotros a ser más
unfortunately, all
susceptibles,
of
sí,
us
de
tend
lo
to
que
be
nos
more
mandan o les manda
susceptible.
un
Yes, whatever
familiar,
we
una
are
persona con
sent
la que
by
creemos.
a relative
Si
or
todo el
somebody
mundo lo
we
está
believe
diciendo,
in,
pues
if
entonces
somebody's
sí,
saying it,
¿no?
should be
Pero
true.
no siempre.
But
Este es el
not
efecto
always is the case. This
de
is
una
the
verdad
effect
ilusoria, ¿no? Donde
of an
creamos
illusion,
una
kind of
realidad
true.
y eso pasa mucho con
We
los
create this in
gobernantes.
our mind,
Se
and
crea
this
una
happens with the
realidad, ¿no?
people who rule.
Por
They
ejemplo,
create a reality. For
COVID no es
example,
peor que una
COVID
gripe.
is not
Todavía
worse
corre por
than the
ahí.
flu. People
¿No?
are
COVID
saying
ahorita está
repeatedly,
bajo porque nos
COVID is
vacunamos,
low because we
todo este
vaccinated
tiempo y ya está de
ourselves
alguna
along this
manera
time.
controlado. No sé
And
si ustedes se
so it is
recuerdan
controlled.
cómo
But if you
estaban las cosas,
remember
pues
how
está
things were,
controlado.
it
La
was
otra parte es la
complicated.
repetición. Dale, y dale, y dale.
Repetition, they
Pues
tell us and
uno
tell us once and again.
pensar
So
que no
everybody
hay necesidad de
thinks
vacunarse.
there's no
¿Sí?
need to be
Si es
vaccinated.
una decisión de usted, pues a lo
If
mejor ya
it's
no se
your
necesita vacunar.
decision,
Pero ¿qué va a
maybe
pasar si no nos
you do not
vacunamos? ¿Ok?
need to
Hay que explicar
vaccinate.
cuáles son
What
las
happens?
consecuencias
We
de no
need to
vacunar.
explain
Hay que
the
explicar que podemos
consequences of
perder
not vaccinating
esa
ourselves. We
inmunidad
can then
de
lose our
rebaño
immunity,
comunitario,
a
¿no? Y
community
que
kind
puede
of
aparecer, como ha estado
immunity.
pasando,
And
brotes,
then
como en el caso de
we can
Salvador.
have outbreaks,
Y pues
as we
bueno,
have noticed.
hay que
So
darnos cuenta
we
que
need to
por nuestra
realize
edad, a veces
that
podemos ser
according
más
to our
susceptibles si
age,
somos
we
niños
can
o si
be
somos
more
personas
susceptible if we are
adultas. Es decir, que
children
no
or
tenemos
adult is
pensamiento
different.
crítico
We don't
o
have
que
them a critical way
simplemente
of thinking,
no tenemos
or
ganas de investigar
we
más
do
allá.
not want to research
Entonces,
more.
es muy
So
importante que
it is
nosotros
very
pasemos la
important
información de una
that we
manera.
provide the information
Entonces,
in the
la
right way.
cosa acá es, ¿de qué
So
estamos hablando de esto? De la mala
what
información o
we're
de la
saying is
desinformación
we
o
are
de los
speaking
rumores
about
o de los
misinformed,
chismes. Pues estamos
and
hablando
well,
porque si nosotros sabemos cómo se propagan, vamos a poder
if
nosotros
we know
utilizar
how
esa
they
misma
spread
estrategia
out,
para
then we can
que la
use the
gente
same
se
strategies so that
inocule,
people
para que la gente se
can
vacune. Si
actually
ustedes piensan
get
que
vaccinated. If you believe
una persona está infectada
that the
porque
person
aceptó
got
una
infected because
información
they
mala, un
accepted
rumor muy
a
malo,
rumor or
de
wrong
que la
information
vacuna te causa autismo, por decir algo,
that, for example, the vaccine
entonces
produces autism, to say
está
something.
infectado con ese virus.
So
¿Sí?
they are
¿Cómo podemos
infected
hacer
with the
nosotros?
virus.
Bueno,
So
pues
what
nosotros
can we
podemos
do?
inocularlos, podemos
Well, we
decirle,
can
dar
get vaccinated
información
and provide
para
information
antes de, ¿sí? Dar la información adecuada para
so
que cuando
that
llegue esa
before they get the right information,
no
and
llegue
once
tarde.
they
Y
get
eso
it,
no es cierto, yo lo sé
they
desde hace mucho.
know beforehand for a
Eso,
long time
toda la
that that's not
investigación de
true, and that
años
there's
y años
research
nos
for
está diciendo
that's taken
que
years
no hay una relación
telling
entre
us
autismo
there's
y
no
vacunación.
relation between vaccination
La
and
persona que sabe eso,
autism.
si usted le puede dar eso a la
If
persona,
you
ya
can
está
provide
inoculada,
these to
ya está
people and
vacunada
they are
contra esa mala
vaccinated
información.
against this
Entonces,
wrong information or
en el
misinformation.
remedio,
So
no, en el problema o en la enfermedad está el
in
remedio.
the
Lo mismo
disease,
que
we
lo
find the
provoca,
remedy.
junto
There's
con
a
eso
saying,
podemos
the same
utilizar
thing that
para
produces it
salir
is
de
what
eso.
we can use.
Y como decía el doctor, las
And as
prácticas
the
de
doctor was
rigor, las
saying,
prácticas de higiene,
the
esas siempre las tenemos que
hygiene,
tener,
typical
que es
practices we should always have,
como lavarnos las
such as
manos,
washing our
como
hands,
bañarnos, tener higiene,
taking a
como tapar la
bath,
boca
hygiene,
cuando
cover our
estornudemos,
mouth if we
igual,
sneeze,
corregir datos,
and correct
prepararnos para la
information and get
desinformación, desarrollar resistencia
prepared for
psicológica, es decir, que no
misinformation,
creamos todo,
develop
¿ok?
psychological
Tener
resistance.
pensamiento
This
crítico.
means not to
Esas
believe
son las
everything.
prácticas de
Have a
higiene, no
critical
solamente para
thinking.
COVID,
This is
no
hygiene not
solamente
only for
para
COVID,
política, no solamente
not only
para todo,
it's
para
for
nuestras
everything.
relaciones, para
It's even
nuestra
for our
vida, para nuestros
relationships, for our
hijos.
life.
Pero bueno,
But well, So that's the idea, that you get to think this way, that the information is the vaccine for misinformation or rumors and false information. And the only thing I want to mention here, because you will receive the presentation, is if a person receives a rumor and sends it to two persons, it will spread out, as you see here in this diagram. One person sends it to three, and one of these three people sends to another two, and from these two, other two, and these two, other two. So just go figure. In a little while, it'll be like this. So if we do exactly the same thing, if this person does not send it to one person, so see all that we can avoid just with not sending it to one person. So we need to be cautious. We need to be more intelligent. We need to be more strategic on what we say, on what we repeat, such as rumors or not. Okay, well, with this, I finish with my strategies that I wanted to share that you can use in each of them. There's research to back up this that we can share on how we are using it, and in Europe and in our country and in this scheme. But please remember that we are now working with a big system, so we need to do a big effort. Sorry for interrupting. Great information. I just want to remind you that we have less than 10 minutes now. Thank you, Marta. And yes, we have some resources for this purpose. Resources are being updated. We have here, for example, the comic on vaccination. We have all the links here. It's for free. You can download it, and it connects the people with their reality, what they value, in a clear and simple way, and provide practical solutions. The COVID page was just updated, and you can see it here. Everything the doctor just said is in a graphic way here, which is great in this kind of communication. Everything the doctor said is here. Who can get vaccinated, where, how, and you can show this and share it with people. We also have a flip chart that we use for COVID. You can see it here. We just edited it. It's in English and Spanish. All our materials are in English and Spanish. The page where you get to see COVID information is also being updated. Now, remember, all this information can be used because it has to do with the vaccines. We do not have to reinvent the wheel. We just need to extract it and update it. So we have another flyer here that you can print in one pager, and it's updated. And here we have a handout for communication campaigns with a group of materials, for example, on how to get vaccinated, and you can use it for this or any other topic like diabetes, infectious diseases, hypertension. All of this can be edited, is shareable. We have videos on how you can do this. So these are some examples. If you would like to carry out a micro campaign on communication with your community, you don't need to wait for someone to do it for you. You can actually change the wording, the pictures, everything you need. And to finish, just to say that this session provided by the Dr. Rodriguez yesterday in Spanish will be repeated on Wednesday, I think October the 22nd in English, in case you would like to invite someone. This session is recorded in English and Spanish, and you will get it. This is the community piece of the sessions of Dr. Rodriguez. And well, this is what the doctor provided yesterday, and those who couldn't attend, we will be sending the recording. So we also want to mention, oh, I can present this. Oh, yes, we are now on Substract. Just to let you know, we added our blog to Substack in order to broaden our outreach. It is independent of our email list, and it covers many, many topics from the point of view of MCN. Next slide, please. Please share your stories on how this has helped you or supported you, and give us a review, please. And this will help us broaden our scope. Give us a review, please.
Y recuerden que pueden conectarse con MCN visitando a nuestra página web en
And please remember, you can visit our webpage in www.migrantclinician.org, and you can actually find our most recent resources, and you can also get to our email list, and you can also let us know when you finish, and you can also follow us in social media. Yes. This you see here is because of Halloween. It's not on purpose.
La próxima.
Okay, next. Thank you, Alma. And well, here is the QR code for the evaluation. Please remember, it is a requirement to send your evaluation to submit it. So if you want to receive a certificate of completion, you need to do this. And we have a few minutes to answer any questions you might have while you do your evaluation. I don't know, Esther, if you have a question around there.
Aquí está hablando Elizabeth. Tenemos
Elizabeth
una
is speaking
pregunta
here. We
que
have a
dice,
question
en inglés.
in English.
Is COVID vaccine given every year? Sería uno para el doctor.
Sí. Es de los niños en
Yes.
adelante, de los 6 meses, está
Children 6
recomendado.
months old and
Y se da
above is
durante todo el
recommended
año.
every year.
No es como la
Yes,
influenza que
it's not
que
as
se puede usar
flu
todo el año.
that can be
Se
used all year
recomienda más
long,
bien
but
en la
is
época esta de
recommended
septiembre a
in this
marzo,
season,
que
September to
cambia
March,
la temperatura y
because
aumenta el riesgo,
temperature changes
igual
and
que la de
risks increase,
respiratory
as well
sincitial,
as the
que también se recomienda de julio a marzo.
RSV that
Pero
is
la vacuna de
recommended also,
influenza
or
puede ser
VSR,
en cualquier
from
momento,
June to March. But the
aunque
flu
ahora hay
one
una
can be
versión
any point,
actualizada
although
que
there's an updated
comenzó ahora en
version
verano.
now that started in summer.
Algo que quería mencionar, Alma,
Something I wanted to
que
mention, Alma.
¿por qué es que ahora están habiendo tanto problema con la
Why is
vacuna
it
y
that we
antes
have a lot of
obligaban a
problems with the
poner la
vaccine
vacuna?
right now and it
La
was mandatory
diferencia es que
before? Well,
antes
the
había una
difference
pandemia
is there was
y
a
el
pandemic
gobierno
before,
podía dar unas
and the
instrucciones o una
government
orden,
could
el
give an
FDA y el
order
CDC
to the FDA and
daba una
CDC.
orden.
They
Ya no
just
hay
provided an
pandemia,
order.
por lo
As there's
tanto es
no
que cada
pandemic
cual puede
now,
opinar
each
y
one
dar
can have an
recomendaciones.
opinion and
Por
give a
eso hay tanta
recommendation.
confusión
That's
ahora.
why we get such a confusion now.
Gracias, doctor.
Thank you, doctor.
Si quieren, pueden levantar la
If you
mano y
want,
yo
you
los
can
pongo
raise your
en
hand and I can unmute you
de silencio para que puedan preguntar.
so that you
sus
can ask your
preguntas.
questions.
Nomás levanten la mano.
Just raise your hand. In the meantime, I can provide an answer, Marta. We have questions about how they can find the comics and the information. Everything is in the internet webpage that you are looking at. Everything is for free. You can actually download it, and we have some templates where you can actually insert your logo. So you can print it if you
Sí,
want.
gracias, Alma.
Thank you so much, Alma.
te voy a dejar
Miriam,
que le quites
I will unmute you.
el silencio. Adelante, por favor.
Go ahead, the floor is yours.
No le
No
escuchamos.
se oye.
Oh, we cannot hear you. We cannot hear you.
Sí, creo que
I think,
sí, no sé qué pasó.
I don't know
Pero
what happened, but okay.
si alguien más tiene
Hay
If
otra
someone else
pregunta
has
en el
another
chat.
question, there's another question.
Enedelia pregunta
And
cómo
Edelia is asking,
podemos medir
how
el
can we
impacto de
measure
los
the impact
trabajadores
of
de
the health
salud comunitarios
community
en la
workers
aceptación
in
de
the
las vacunas
acceptance of the
y la
vaccines
confianza dentro de
and the
las
trust
comunidades
within the
a las que sirven?
communities that they serve?
Wow. Esa es una muy,
Wow,
muy
that
buena
is
pregunta.
such a good
Ah,
question.
yo creo que
I
una de las
believe
cosas es que
one of the
nuestras
things is that
organizaciones
our
deberíamos de
organizations
acostumbrarnos a
must
ver
get used to see
la frecuencia o los
the
indicadores,
frequency, the
los índices de
indicators, the
vacunación
indexes of
antes,
vaccination
después y
before,
durante
after, and during
las épocas, ¿no?
the different
Y
seasons,
ver, por
and
ejemplo, el
see,
número
for
de
example,
pláticas
the
dadas
amount
sobre la
of
vacuna, o no solamente sobre
speeches
la
or
vacunación, sino
conversations
sobre la
provided not
confianza
only
sobre la
about the
vacuna.
vaccine, but the
Esto
trust on
requiere
the vaccine.
que cada uno
This
nuestras
requires that each of
organizaciones
our
gubernamentales
organizations,
desarrollemos
NGOs,
formas de
develop
indicadores y que
indicators
desarrollemos
and
proyectos
develop
donde podamos
projects
poner
where we
bien
can
claros
actually
como A,
place
B y C
really clearly,
el
like
impacto que
ABC,
esto provoca.
the impact of
Yo
our
creo que
vaccines.
hasta
I
el
believe
momento
so far
dice mucho que
there's a lot that is
somos
being said
organizaciones muy buenos, que somos
about
buenos, que hemos
CHWs being
incorporado,
great and
tenemos
they
un
have been
programa
incorporated to the
de
community with their
equipo médico
programs and the
técnico,
medical
todavía
teams,
falta
but
más evidencia
we need more
para
evidence
justificar
to
todo
justify
esto.
all
Entonces yo
this.
les invito
So
a que con
I
sus
invite
equipos
you that
traten de
together with
hacer
your
un poco
teams,
más de
you
monitoreo y
try to
evaluación
monitor and
al respecto.
evaluate more.
Gracias, Alma. Vamos a intentar otra
Thank
vez
you, Alma. Let's try
que Miriam pueda
again to see if
responder.
Miriam can ask. I think you can hear me now. Thank you. Go on.
Muchas gracias por la invitación nuevamente.
Thanks
Muy
again for the
contenta de estar
invitation. So
participando
happy to
con
be
Center for
participating
Healthcare, centro comunitario en donde trabajo
with
por
the
algunos
community
años y que
center
he
where
sido
I've
de los
been working for a
confiados
few
en
years
el
now, and
trabajo
we've
que
always
ustedes
trusted
desarrollan
in the
año a
work you
año.
do every year.
Trabajamos con
So
muchos
we work
migrantes
with
que
a
vienen
lot of
por la zona de
migrant,
acá de
with many
Maryland,
migrants
Eastern
that
Shore
come through
y
Maryland, Eastern
el
Shore,
material que ustedes nos
and the materials that
proporcionaban
you've
en ciertos
provided
momentos en los
at
seminarios
certain
en
moments
línea
during the
han sido de
webinars
gran ayuda
has
para
been
poder
so helpful
educar a la
to
población hispana.
educate
Les
the
agradezco
Hispanic population.
muchísimo
So I'm so
por
grateful
todos esos
for
materiales
all
que
those
han sabido
materials
compartir.
that you've
De
shared
igual
with us.
manera, con el tema de las
Likewise,
vacunas, es
regarding
una situación bastante
vaccines,
delicada,
it's a
pues hay
very
muchos
delicate
pacientes que
situation. There's
simplemente
many
rechazan
patients
el
that
hecho
just
de tener la vacuna,
reject
¿no? Y sobre todo con
vaccines, especially
las experiencias que
for
ellos
the
han
experiences that
lamentablemente han
they
vivido después de
share
tomarse estas vacunas.
that they
Entonces
have
hay un
lived through
poco
after getting those
de
shots. So there's
desconfianza,
some
a pesar que el
mistrust,
médico
even if
o
the
el doctor
doctor
trata de
tries to
educarles un poquito al respecto,
educate
de
them a little
conocer
bit,
la
to
importancia de
share the
usar la vacuna para
importance of
prevenir
getting
problemas,
vaccinated to
no,
prevent
complicaciones mayores. Los
major
pacientes lo hacen.
complications.
Ahora tenemos una gran
Now
cantidad de
we have
pacientes que no tienen
a
seguro
lot of
médico por
patients
otro
that
lado
do not have
y
medical
ahora
insurance,
tiene un costo la vacuna
and now
en
the
ciertos lugares,
vaccines
¿no?
have
En
a
los centros
cost in certain areas.
nuestros
In our
llegan
centers,
con un valor a pagar y pues
they
obviamente
arrive with a
tenemos que
price
cuidar
to
de nuestros
pay,
pacientes
and we need to charge our
y mucha gente
patients.
no sabe a dónde
And a
acudir
lot of
para la
people
vacuna de
don't know
manera
where to
gratuita. No
go
sé
to
si
get free
ustedes
vaccines. I don't
pueden,
know if you
tal
can
vez conocen
maybe
los
know
lugares o
the
centros
places or
donde ellos
centers
podrían recibir estas
where
vacunas
they could receive
de
these
manera
vaccines
gratuita
for
o tal vez
free,
a través de
or
alguna
maybe
clínica
through
de
a
vacunas que
vaccination
se acercan
clinic that you
alrededor de esta
know
área.
of around this area.
Okay. ¿En dónde está usted, Miriam?
Where are you
Estamos en el
located?
área de Eastern Shore,
Media,
lo
we're
que
in
son los
Eastern
condados de
Shores in the
Wycomico, Somerset
Wacomico,
y Worcester.
Somerset, and Worcester
Yo lo
counties.
que sugeriría es
What I
que
would
se acercaran
suggest
a los centros
is
de
that you
salud,
approach the health
preguntarles si
centers, the
algunas de
community
las
health centers, and some of
organizaciones que
the
están
organizations
trabajando en el área,
that are working in the area.
desafortunadamente donde ustedes están,
Unfortunately, where
tienen
you are,
consulado,
there is
pero
no
por ejemplo, los
consulate,
consulados
but
desarrollan
the
ferias de salud
consulate
donde
offer health fairs, and the Ventanilla de Salud offers vaccines, different vaccines for free. But you are in an area that is not close by. So I think you would need to go to one of the community centers, go to one of the centers that work with migrant funds and that still have those funds and see what they're doing. Even foster or find community clinics or health fairs that, if you are within an organization, maybe you can promote, you can organize a health fair and invite organizations that can help underserved populations. Thank you for the recommendation, Alma.
Muchas gracias,
Have a good
Miriam.
afternoon.
Y bueno, con esas ya
Thank you,
ya
Miriam.
se nos acabó el
And
tiempo,
we
así
ran
que
out of
recuerden
time.
que
So
van a
please
recibir
remember
unos
that you're going to
pequeños
get an
documentos donde
email, follow-up
van a
email,
poder
where you'll
bajar,
be able
descargar
to
el PDF de la
download the
presentación,
PDF of the
tanto en inglés como en
presentation, both in
español.
English and in
Y
Spanish.
en
And
esas
in
presentaciones,
that
todos los
presentation,
enlaces los van a llevar
all the links will
a los sitios. Así que
take you
los
to
enlaces van a estar
the
en
links are
en la
live
presentación.
in the
Con eso
presentation.
voy a
So with
cerrar esta
that,
sesión,
I'm
pero
going to
muchísimas
close
gracias
down
por
this
estar con
session and
nosotros
thank you very much
y
for being
nos
here with
vemos en
us.
la próxima.
See you next time.
Gracias a
Thank
nuestras
you
intérpretes,
to our
Gabriela y
interpreters,
Azucena, y
Gabriela and
gracias al doctor
Azucena,
y a Alma. Gracias a todos.
and the doctor and
Que tengan
Alma.
buen día.
Thank you so much.
Buen día.